who's this bugger? My name is Mike Jeans. For a large part of my career, I've been a rural generalist doctor, which essentially means I go where the need is greatest, often into communities that have very little access to any medical care at all, out in the bush. So the Jeannie Burns Buckner Hospital is in Bingo district in a place called Chisizya. It's in the far northwest corner of Zimbabwe, and it's one of the most remote and underserved areas in the country. It's a very long, very rough road, as anyone from the Revolved team will tell you. And the hospital exists because of this remarkable woman called Jeannie Burns Buckner, who saw the suffering that community endured day to day, and she refused to look away. You meet the people, you see what they endure just to access very basic care, and it changes you. So that community got under my skin. The people working with me to provide that sort of access became lifelong friends, and it stayed that way since. But this hospital is not a convenience at all for these people. There is no other option nearby. The next level of care is hours and hours away on roads that are barely roads. If this facility that we've built is compromised, people die from conditions that are entirely treatable, and that includes women in labour, children with malaria, trauma victims, people who, with a functioning hospital, would walk away. And I think we just need to emphasize that to people. Well, I would like to emphasize that to people, especially because, as we've seen, the community in Chisizya has already fought so hard just to have this place exist. Jeannie has fought so hard just to have this place exist in the first place, and it would be a tragedy to let it fall into a state where it can no longer serve them safely. We would be doing the community a big favor if we could formalize the plumbing system, at least at the hospital, so that when they come for care and they're vulnerable with wounds, or they're in a setting where they have to share amenities with other people, at least we won't be adding to the burden and the risk of further disease for them. The solar system is one that's quite close to my heart, just because I've had a fair few hairy experiences when the lights go out and things need to be done. So the solar system provides the beating heart and soul of the electrical infrastructure that we would need, not just for the lights, but also to run pumps that will run water, and also to provide electricity for the machines that we will need to monitor patients, to treat patients, and things like ultrasound machines, which we will need to do scans for pregnant women, and possibly even in the colder months, heaters for newborns to keep them warm when all the blankets in the world won't do on a cold Bingo morning. So the solar and the plumbing are absolutely essential to the functioning of this hospital. And again, they're not glamorous things to fundraise for, but they're absolutely necessary. It really is a dream team, in my opinion, and I'm very excited about the project because I think the people of Chisizya and the hospital itself will benefit in ways that we will struggle to measure in the future.
The rain keeps coming, the rain keeps coming down. Wash away my pride.
Yes, this is leprosy. I think this is now our fourth patient.
Also for 4 years,
yes.
For sure.
Or even more than, maybe you can say 5 to 6 years.
Okay.
Being like this. But we need to order medication today, not any other day. Yeah.
And it is incredible that Jeannie, through her generosity and many others, came together to build the impossible in the midst of nowhere. I just could imagine the relief that mothers must feel knowing that they now have this place that they can go to. And they don't have so much fear when it comes to giving birth.
Proving something out that is desperately needed, asked for by the community, and then growing it and making an impact that is far beyond one hospital. But one hospital is the spark that started it. And it's beautiful. And it literally is like light in the darkness.